Seattle's been really intentional about talking about supervised consumption spaces instead of supervised injection. And there's a couple of reasons for that. One is racial disparity. We know that crack cocaine enforcement really fueled a lot of the racial disparity that we see in King County. And crack cocaine is a drug that's primarily smoked. When we think about the implications of a space in which people can inject drugs but not smoke drugs, it really leads to the question, who's left out? And if we leave out people who smoke drugs, those are the people who are open and vulnerable to law enforcement, and the people who inject drugs are not. And we don't want to set up more disparity. We in fact want to treat all drug users with equity and dignity and respect. So it's really important that spaces be inclusive. And then the other reason really comes from a public health approach of we know that injecting drugs is the most dangerous way to consume. If and when someone says, hey, I'd like to move from injecting to smoking, the answer to that needs to not be, great, go back out to the alley. We want to keep people in the continuum of care, keep them connected to the relationships that they develop in that space. We don't want to kick anybody out. We want to bring people in. And the best way to do that is to not limit ourselves. Let's have drug consumption, not just supervised injection.